I'm Hannah Larson. I am a Spanish education major.
I'm Sarah Revore. I'm a biology major.
And I'm Tiffany Rasmussen. I am also a biology major. So this project is the impact of systemic injustices on Latinx women's sexual and reproductive health care. We were interested in this topic because of our combined majors of both Spanish education and biology, looking at healthcare jobs. And so we decided to look at a combination of both healthcare and Latinx. And so this is for our religion, race, and social justice class, also a PEAK class. This project focuses on the systemic injustices that Latinx women face when attempting to receive healthcare, especially sexual and reproductive healthcare. We believe that both economic, social, religious, and cultural factors affect Latinx women receiving quality healthcare. Research was done to look into general disparities and to see how these may affect Latinx women receiving healthcare. This would help us to understand basic reasons that Latinx women would have difficulties in receiving quality healthcare. Research was also conducted to look into disparities in sexual and reproductive healthcare and see how systemic injustices cause barriers for Latinx women to receive these services. A survey was sent out to members of Concordia's Latinx Organization of Achievement and asked to answer questions regarding their experiences with healthcare. These findings were compared to previous research done in this field. Religion also plays a large role in the lives of much of the Latinx communities. This was assessed through research and questions of the survey to see if religion is a common factor that causes some Latinx women to find barriers to receiving female-centered healthcare.
Latinx women face numerous barriers when it comes to accessing healthcare services in the United States, and these barriers only multiply if the woman is an immigrant with limited English proficiency or LEP. Dr. Karen Hillstrom noted that the healthcare systems in Latin American countries function much differently. She noted that contacting a doctor with questions is much less of a formal process, and oftentimes patients are able to message or call their doctor directly on their personal line. And as far as language barriers go, there's a lack of interpreters in the US. NPR reports that the 2016 survey of 4,586 hospitals by the American Hospital Association, only 56 of these hospitals offered some sort of linguistic or translation services to their patients. According to a study conducted by Passan Massey of Georgia College and University, Latinas identified barriers such as fear of results, embarrassment of being touched, access to healthcare, and language issues as reasons for not obtaining regular screenings. From our own survey, we can also conclude that a lack of cultural awareness from medical providers, the expensive care with or without insurance, and a general confusion of our medical system and proximity to healthcare facilities are other reasons in which Latinx women may face difficulties while receiving medical care. Above all, many Latinx women feel as though their identity itself has played a role in the quality of care they receive, which only promotes the fear and lack of trust in the US healthcare system. Some of our survey responses noted that they don't feel like doctors take them seriously or that they don't understand or diminish their pain simply because of the color of their skin.
Use of and access to contraceptives are a critical part of women's reproductive health, and for the Latinx community, unfortunately, are often met with educational and economic barriers. In a study by Dr. Carla Kostler, surveying access to and contraceptive choice among women who have experienced discrimination based on race, class, and gender, documented that participants who had experienced discrimination were more likely to choose less effective forms of birth control, including barrier methods and withdrawal. However, the study also found that after eliminating financial barriers and providing education on contraception through the Contraceptive Choice Project, women were more likely to choose long-acting reversible contraception, or LARC, the most effective form of birth control. So these findings suggest that education and financial barriers are primary in preventing access to contraceptives, and these barriers often correlate with experiences of discrimination. Financial barriers are particularly prevalent within the Latinx community as they encompass one of the highest populations of individuals living at or below the poverty line in the US, indicating that improving access to these effective contraceptives requires removing economic barriers and providing financial assistance. Furthermore, various intersecting forms of internalized oppression contribute to barriers to contraceptive use among Latinx women. For example, a survey of contraceptive knowledge and use among Hispanic and non-Hispanic whites in the US demonstrated that Latinx women are more likely than their white counterparts to believe that birth control is a woman's responsibility, presenting a barrier if their partner is unwilling to use contraceptives. This attitudinal barrier is reflective of internalized misogyny and discrimination based on gender. Furthermore, Costler's study on experiences of discrimination and contraceptive use demonstrated an interesting barrier in the Latinx community based on internalized racism, finding that Latinx women were more likely to believe the government tries to limit minority populations by endorsing the use of contraceptives for women of color.
An important aspect to mention when talking about Latinx healthcare is the use of a curandero, or a traditional healer who uses more natural remedies such as herbs and plants, as well as spiritual healing to cure illnesses. We received a survey response stating that it's not that we don't believe in modern medicine, it's just been proven to hurt us more rather than heal us, which shows that some Latinx women believe in modern medicine, but the barriers they face in receiving said care outweigh the benefits. Dr. Wei Chen Tung reports that women use curanderos because they are affordable. They work in the same neighborhoods where Latinas live and are available for undocumented Latinas who are not eligible for public programs. And they also share the common connection of a language.
Additionally, given that approximately 48% of the Latinx population in the US identifies as Catholic, adherence to traditional Catholic teachings and practices is an important factor to consider when examining attitudes towards contraception and abortion use by Latinx women. A survey of Catholic and non-Catholic Hispanic women in the US found that Catholic women were less likely than their non-Catholic counterparts to use male condoms and the pill as well as abortion, but were more likely to use natural family planning, a method that does not utilize hormones nor barriers but follows fertility awareness throughout one's menstrual cycle. Natural family planning is the only form of birth control approved by the Catholic Church, which perhaps explains why it is favored by Catholic women in the Latinx community, however, has one of the highest rates of failure among contraceptive methods.
As a part of our research, we distributed a qualitative anonymous survey to female students and faculty at Concordia with the assistance from the Latinx Organization of Achievement. The survey collected a series of demographics questions about age, origin of birth, and marital status, and then provided a series of open-ended short answer questions to allow the participants to expand upon their experiences with healthcare. These questions included: 1, how would you describe your experiences with the US healthcare system? Feel free to elaborate here, rate as 1 being the worst and 5 being the best. The second question was, have you ever avoided or been unable to go to the doctor when you needed medical attention? If so, why? 3 was, do you think your identity, aka gender, race, class, religion, etc., has played any role in the quality of care you've received in the US? If so, explain. 4, if you have received female-centered healthcare, i.e. birth control, consultation, pap smear, mammogram, etc., how were your experiences? And 5, is there anything else you would like to share regarding your experience with healthcare in the US?
Some of our most notable responses included, during my labor, the doctor did not know how to deal with the stress I had. I think they did not have enough cultural training. Another included, I hate going to the doctor. It's annoying and it feels like I am being judged. And finally, US healthcare is sometimes good, but all the time is very expensive, even with insurance. So the responses we collected largely mirrored the literature-based research we conducted. Survey participants highlighted the prevalence of financial barriers, as well as feeling like the quality of care received was impacted by race and class.
In conclusion, this project was conducted to see the impact that systemic injustices have on Latinx women, especially in their access to healthcare. We looked specifically at sexual and reproductive healthcare to see the impact that systemic injustices have on these communities, and we found there to be many hardships. We received firsthand accounts of this through an anonymous survey, and many of the surveyors stated that they had hardships in receiving healthcare due to both economic reasons and to cultural ideals. Some of the women surveyed felt that they were not very respected in their patient experiences. We found that some of the disconnect between the patient and the doctors was due to some cultural or religious aspects, as many Latinx women identify with a Catholic or strongly spiritual tradition. We found that most of our research supported our hypothesis that Latinx women do often experience barriers to receiving quality healthcare. This research has made us much more informed of these issues, and we hope that you have taken something away from this presentation. We would also like to thank Dr. Michelle Loca, our professor in the class, for mentoring this research project. We would like to thank Sammy Arocho and the Latinx Organization of Achievement. We are so thankful for their collaboration and willingness to share their voices with us. Additionally, we would like to extend our gratitude to Dr. Karen Hillstrom, who shared her experiences with healthcare both as a parent, patient, and a medical interpreter. Thank you.